Hello, welcome everyone. Thank you for joining today. If you need any assistance, please let me know in the chat panel, and I'll be happy to help provide any technical support I can. Just to let you know, we are recording today's session, and we do have live transcription going. You can each manage that on your own screen by clicking on the CC button in Zoom and selecting Show or Hide the transcript there. So once again, we will be having time for Q&A towards the end of today, and I think I will hand things over to our moderator, Cherie, to get us going.
Good afternoon, everyone. Want to pull up my notes. Like we're still having some more people coming in. Okay, I'm gonna go ahead and get things started. We do have a lengthy presentation for you all today. So good afternoon and welcome to the Title V Competitive Sexual Risk Avoidance Education Program, New Grantee Orientation. My name is Cherie Thompson. I am a project officer and the APP Program Office Lead for Title V Competitive SRAE Program. Unfortunately for none of you, you have me as a project manager, but rest assured you are all in good hands with your assigned project officer. I'd like to introduce you all to Labrita White, Director of the Division of Optimal Adolescent Development, who will get things started this afternoon. Next slide.
Thank you so much, Cherie. Thank you. So good afternoon. As Cherie stated, I'm Labrita White. I am the Director of the Division of Optimal Adolescent Development. Some of you I may know from prior grants that you have been awarded through our program when I was in the position of program manager. So I'm delighted to welcome you to the Family and Youth Services Bureau's Adolescent Pregnancy Prevention Program's new Grantee Orientation webinar. I'm also delighted to have the opportunity to congratulate you on your awards. I'd like to thank all of you for your hard work and diligence in responding to the Title V Competitive Sexual Risk Avoidance Education Notice of Funding Opportunity, and commend you on submitting well-developed applications to provide prevention education to youth in your communities. And for many of you, some of the most vulnerable youth populations. And so we are looking forward to learning about the success that you have in implementing your projects over the next couple of years. I'm pleased to say that FYSB awarded a total of just over $8.9 million in the Title V Competitive SRAE grants to 27 organizations to educate youth on the avoidance of non-marital sexual activity, including those critical topics A through F that are outlined in the legislation. So for today's orientation, we're providing you the opportunity to look a little bit more closely at the critical components of the Title V Competitive SRAE, well, it's really the Title V Sexual Risk Avoidance Education legislation, the processes and practices of properly managing your grant, and the resources available to help you do so. The APP team looks forward to working with you throughout this 2-year project period, along with the contractors who will be providing you with training and technical assistance to support you in program implementation, data collection, and for some evaluation activities. I strongly encourage you to take advantage of training and technical assistance services available through our contractors and to contact us, the federal staff, should you have any questions as you prepare to initiate program implementation. Some may have started already, but if you haven't, to make certain that you meet the deadline in the coming weeks to ensure that program implementation has begun. And so we've planned to share a significant amount of information, as Cherie has already noted, on today. And you'll receive access to slides to serve as a resource as you manage your Title V Competitive SRAE grant. But before we proceed, I'd like to take a moment to share with you where FYSB fits within the U.S. Department of Health and Human Services, and that we have some grantees that are really new to the Administration for Children and Families and FYSB. So if we can move to the next slide, and you'll see within the U.S. Department of Health and Human Services, we have the Administration for Children and Families, the Administration for Children, Youth and Families, and within the Bureau, there are 4 divisions. And the Division of Optimal Adolescent Development is where your program is supported and housed under our Adolescent Pregnancy Prevention program. Okay. So my final task of today is to introduce you to the Family and Youth Services Bureau staff. And if we can move to the next slide, the APP program and Family and Youth Services Bureau management and leadership team consists of Kimberly Waller, our Associate Commissioner, Debbie Powell, who is our Deputy Associate Commissioner, myself as Director, and Captain Corey Palmer, who is fairly new to our team. He is a Program Manager. Next slide. And if we can move to the next slide. Okay. The staff, the hardworking team that will support you in the days and months and couple of years to come are here on your screen. We have Kathleen Derrick and a new staff person that will be joining our team. Her first day is today, Catherine Godeski, Megan Hill, Nakia Martin Wright, Ricky Richard, Takia Sellers, Cherie Thompson, Shakira Williams, and Dara Yaya are all program specialist staff. And also a critical component to our team are 2 other persons, Tarshika Thompson, who's our executive assistant, as well as Owen Burns, who serves as our communications manager. So once again, it's been a great opportunity to be able to greet you, to welcome you, as well as to congratulate you on your award. My final closing remarks are really just to say, welcome to the APP program. Remember, FYSB is here to provide you with the assistance, guidance, resources, and support you need to be successful in all areas and aspects of your program. Again, congratulations. I wish you the very best. And thank you for your continued commitment to our youth. At this time, I'll turn it back over to Cherie to get us started. Cherie.
Thank you, Labrita. Again, my name is Cherie Thompson. I will be one of your many presenters today, as you can see on your screen. I hope you have your snacks, your lunch, some coffee, and are ready for this presentation. Before I go into the agenda, if you do have any questions during the presentation, we ask that you put them in the chat, or at the end, we're going to have a question and answer portion. You can come off of mute and ask your questions or continue to use the chat for your questions, and we'll get your questions answered at the end of the presentation. Next slide, please. So we have a robust agenda for today, as we will be providing critical information to support your successful implementation of competitive SRAE projects across the nation. We'll provide an overview of the Family and Youth Services Bureau, FYSB, and Adolescent Pregnancy Prevention Program. The purpose and requirements of Title V Competitive Sexual Risk Avoidance Education Program, roles and responsibilities of the Office of Grants Management, also known as OGM, information on performance measures and evaluation, and then closing out with technical assistance, websites, and other resources. So first, we will review the purpose and scope of the Title V Competitive SRAE program. Next slide, please. So APP takes on a holistic approach to support state, tribal, and community efforts within our PrEP and SRAE programs to promote medically accurate prevention education. Next slide, please. SRAE programs implement evidence-based approaches that align with the needs and desired outcomes for youth and teach the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors such as underage drinking or illicit drug use without normalizing teen sexual activity. Next slide, please. The Title V SRAE program is authorized and funded by Section 510 of the Social Security Act. It is critical that grantees ensure all programming complies with the mandated requirements to include exclusive implementation of education and sexual risk avoidance, defined as voluntarily refraining from non-marital sexual activity. Other legislative mandates require that your program use medically accurate information, which we will discuss later, as well as implement evidence-based approaches that meet the needs and desired outcome for youth. The Title V competitive SRAE funding stream funds local organizations and entities within the states that did not apply for Title V state SRAE. Organizations and entities in the list here were eligible for FY 2022 funding. The goal of the competitive SRAE program is to provide messages to youth that normalizes the optimal health behavior of avoiding non-marital sexual activity. The objectives of the competitive SRAE program are to implement curricula that includes medically accurate information referenced in peer-reviewed publications by educational, scientific, governmental, or health organizations. Another objective is to select a sexual risk avoidance curricula and/or strategies with an evidence-based approach to combine research findings with practical implementation that aligns with the needs and desired outcomes of the targeted audience of youth. Teach risk avoidance skills through methods that do not normalize teen sexual activity, in addition to the A through F topics outlined in the Title V SRAE legislation, and to target youth ages 10 to 19. Next slide. Okay, thank you. All competitive SRAE programs must meet the following requirements. Teach medically accurate, culturally and age-appropriate information, use evidence-based interventions or strategies, use a positive youth development framework, target the appropriate population, provide appropriate referrals to healthcare and other services, conduct research and evaluation, participate in a national evaluation, and collect and report performance measures. And all of this we'll go over today. Next slide, please. Thank you. Competitive SRAE programs must, at a minimum, implement evidence-based programming. Selected interventions must be promising practices or have evidence of effectiveness with the target populations and adhere to the following requirements. Interventions must be medically accurate and complete. And to go a little bit into detail, medical information must be verified or supported by the weight of research. Program materials such as texts, supplements, workbooks, videos, flyers, handouts, posters, and flashcards should be reviewed in comparison to current medical statements of fact in accordance with the most up-to-date scientifically supported information. Grantees may provide information on contraception and ensure that students understand that contraception offers physical risk reduction, but not risk elimination. The education cannot include demonstrations, simulations, or distribution of contraceptive devices. Interventions must also be age appropriate with regard to the developmental stage of the intended youth audience, meaning that the topics, messages, and teaching methods implemented by the project must be consistent with the developmental and social maturity of the program participants. And lastly, interventions must be culturally appropriate, recognizing the experiences of youth from diverse communities, backgrounds, and experiences. Next slide, please. Thank you. Per the SRAE legislation, all programs are required to follow the A through F topics as outlined. And I'll just read a few because I'm losing my voice, as you can tell. Programs must teach the holistic individual and societal benefits associated with personal responsibility, self-regulation, goal setting, healthy decision-making, and a focus on the future. The increased likelihood of avoiding poverty when youth attain self-sufficiency and emotional maturity before engaging in sexual activity, and then how other youth risk behaviors such as drug and alcohol use increase the risk for teen sex. Next slide, please. Competitive SRAE programs must include positive youth development as a part of any risk avoidance strategies. This is done to help participants build healthy life skills and protective factors, and empower participants to make healthy decisions, provide tools and resources to prevent pregnancy and STIs, and prevent youth engagement in other risky behaviors. The program approach must also include service linkages to local community partners that support the safety and well-being of the target population. Next slide, please. Title V competitive SRAE programs may only provide education to youth on sexual risk avoidance. Funds may not be used to provide separate services such as healthcare, educational, career development, or counseling services. However, programs should encourage youth or their parents to enroll in assistance programs. The next slide, please. SRAE curriculum requirements. The curriculum selected must be age appropriate, culturally and linguistically appropriate, exclusive in its purpose of teaching sexual risk avoidance and the benefits associated with self-regulation. The interventions, materials, and curricula must not promote or encourage sexual activity outside of marriage, but can provide information on contraception that does not include demonstrations and/or simulations of contraceptive devices. Sorry if that sounds repetitive, but it's important. Next slide, please. Thank you. All SRAE programs are to be implemented with fidelity. Implement strategies to ensure that programs are implemented without compromising the core elements of the curriculum that have been identified as essential for achieving program effectiveness. I will now hand things over to Project Officer and APP Program Office Lead for Medical Accuracy Review, Takia Sellers.
Good afternoon, everyone. As Cherie stated, my name is Takia Sellers, and I am a program specialist here in the APP program. And I am going to share some things, just an overview with you all today on the medical accuracy review process. You can go ahead and advance the slides. Next slide, please. And just really quick, I want to share that this is a brief overview. There will be a full training on October 31st from 11 a.m. to 12 p.m. Eastern. And each one of you should have, well, each program should have already received your email inviting you to that. If you did not, if no one in your organization received an email, please reach out to your project officer to let them know, because that means that maybe we are missing some contact information somewhere and we need to make sure that you're receiving emails. So, medical accuracy review. This is the definition of medical accuracy review that we use here in FYSB. The term medically accurate and complete means verified or supported by the weight of research conducted in compliance with accepted scientific methods. and published in peer-reviewed journals where applicable or comprising information that leading professional organizations and agencies with relevant experience in the field recognize as accurate, objective, and complete. So when we talk about medically accurate, this is what we are referring to. Next slide, please. And why are these reviews important? Medical information is constantly evolving, and as new discoveries are made, program materials can become outdated. Medical accuracy reviews help ensure program materials remain accurate, complete, and up to date. Next slide, please. So if sometimes there are issues when the reviews are done, this is just kind of an example of the types of issues that are found. Sometimes the information is inaccurate, incomplete, outdated, maybe poorly referenced or supported by non-scientific studies, or it could be confusing or misleading. I'll also add there have been times where reviews have come back and there are lots of grammar mistakes or punctuation. All of those things will be included in your review. Next slide, please. And so this is what will be requested. So there is an initial medical accuracy review done. Grantees will submit materials to FYSB and Gray Matters / PALTech for review. So Gray Matters, they are our contractors, and so they will do the actual review. And then you'll have an opportunity to respond to any inaccuracies noted. So like on the last slide, those types of things, they'll just kind of list all of the things that they found while reviewing your curriculum, and then you'll have an opportunity to address those things. It'll be in a full report, and then you'll submit your responses and your revisions back to us. So that's kind of how the process works. And I believe that is all I have. Thank you.
Thank you, Takia. Great information. Hope everyone's taking notes and writing your questions down. So next, we will discuss the responsibilities of the APP program office by yours truly. Next slide, please. The program office reviews applications and programmatic reports, responds to programmatic and technical aspects of the grant, ensures the amounts to be awarded to grantees are consistent with current statutory requirements, and monitors grantee performance. Your project officers are the contact person for any programmatic changes or updates. Here you will see a few examples of our duties and when you should contact your project officer. And if you just need to vent, we're there for that as well, because sometimes you need someone to talk to that understands what you're going through. Next slide, please. Grantee site visits and site monitoring visits are essential to the responsibilities of project officers. Your project officer will discuss the scheduling of site visits with you in the near future. The objectives of those visits are to ensure compliance with terms and conditions of the grant and authorizing legislation, to discuss program implementation and observe a program activity, and to provide technical assistance on areas related to the programs. Information regarding site monitoring visits will be shared in the coming weeks, to include a copy of the Grantee site monitoring tool. Next slide, please. I will now briefly review the roles and responsibilities of the Office of Grants Management. They have a scheduled orientation for Wednesday, October 26th, and they will provide more in-depth information to grantees. Next slide, please. Thank you. So the role of the Grants Management Office, they're responsible for fiscal management, ensuring compliance with applicable laws, regulations, policies, and procedures, provide guidance on physical requirements related to grant awards, terms and conditions, Post-award changes, reporting, and closeout procedures. Very important, people. Then next slide, please. And then this is a continued slide, but contact OGM, Office of Grants Management, directly for the following reasons. And always please CC your project officer on these emails. Requesting amendments to an original grant application, such as changes in key personnel, budget modification, carryover request, no cost extensions, clarification of budget issues, particularly allowable costs, and guidance on submitting fiscal reports and other official correspondence. Next slide, please. As an APP grantee, performance progress reports are required to be submitted semi-annually via Grant Solutions. You will submit your PPRs, what we call them, on April 30th and October 30th to cover the appropriate reporting time periods. And you receive this information in your guidance document from your project officer. Next slide, please. The PPR provides narrative information around the following essential performance indicators: major activities, challenges, significant findings and observations, organizational issues, TA and training updates, activities planned for next reporting period. Next slide, please. And please note, prior approval by FYSB and the Office of Grants Management is required for these changes on your screen. So change in scope, no cost extensions, things like that are required. So I would like to now turn things over to Dr. Jerry Rieger of Public Strategies and Laura Halsley of Mathematica to discuss performance measures.
Thank you, Cherie, and good afternoon to everyone. We are going to talk about the performance measures, and I am with Public Strategies and Laura's with Mathematica. I'm going to ask Laura to take the first few slides, and then I'll be back. Laura?
Sounds great. Thank you, Jerry. Public Strategies and Mathematica are supporting ACF, grantees, and their partners with collecting and using performance measures. The performance measures serve several important purposes. They enable the federal government to monitor program implementation and progress, including tracking progress over time. And they're used for reporting to leadership within HHS, as well as for responding to inquiries from inside and outside the federal government. Performance measures can also be used by grantees to inform your ongoing program improvement efforts. Next slide. The performance measures can benefit grantees in several ways. They can provide you with data that you can share with your funders, partners, and others. You can use your performance measures data to inform policymakers, the media, research groups, or other interested parties about your activities. The performance measures can also be used as a foundation for program improvement. You can use them to monitor subrecipient program providers and to assess whether programs are reaching their goals. The data can also be used to identify training and technical assistance needs. And finally, performance measures data can assist you in your sustainability planning and advocating for continued and additional funding. Next slide. This table highlights some differences between performance management and impact evaluation. As shown in the first column, performance measurement examines inputs, outputs, and outcomes. Inputs are the resources that make the program possible, such as the amount of funding, the numbers and types of staff, and the curricula used. Outputs are the direct, tangible products, such as the number of youth who participate and the number of hours of programming provided. Outcomes are the status of participants after services, such as their perceptions of the program's influence on their behaviors. In contrast, as shown in the second column, impact evaluation measures the difference in the outcomes for participants after services to the outcomes for a comparison or control group that did not receive services. This contrast can establish a causal relationship between the program and its impacts. Turning to the next slide, we're going to focus in on the SRAE performance measures. Next slide. They fall into three broad categories. Measures of attendance, reach, and dosage describe the delivery of SRAE programming, including the numbers of participants, the settings in which participants are served, and how much of the programming they attend. Measures of structure, cost, and support for program implementation include the features of the SRAE programs, such as the curricula implemented and the topics covered, staffing patterns and training, and funding. This category also includes program providers' perceptions of implementation challenges and their technical assistance needs. The final category of performance measures is participants' characteristics, behaviors, program experiences, and perceptions of program effects. Grantees will collect these participant-level measures through surveys administered to youth at program entry and program exit. Next slide. There are separate versions of the SRAE participant entry and exit surveys by age group. One version for middle school youth and one version for high school and older youth. The middle school versions contain a subset of items in the high school and older versions. In particular, the middle school versions do not include questions about sexual behaviors. Turning to the next slide. As shown in this table, the frequency of data submission and the reporting periods vary by category of performance measures. Measures of structure, cost, and support, shown in the first row, are only submitted once a year, each summer, and cover a full grant year from October through September. The measures shown in the last two rows, attendance, reach, and dosage, as well as the participant level measures, are submitted twice a year, in winter and in summer, with each round covering the previous 6 months of programming. For instance, during the summer data submission, which happens in approximately July and August, grantees will submit data covering the January through June period that is just ended. As part of your SRAE grant agreement, all grantees are required to collect and submit performance measures. Even if grantees aren't collecting or submitting them yourselves, you're responsible for ensuring that your subrecipient program providers and/or evaluators are collecting and submitting the measures. Through the SRAE PASS contract, FYSB provides training and technical assistance to grantees, their subrecipients, and evaluators on the collection and submission of performance measures and on related topics such as data privacy and security, human subjects considerations, survey implementation, and data transfer from subrecipients to grantees or evaluators. It is the grantee's responsibility to ensure that your subrecipients and evaluators receive notices about the training and technical assistance opportunities. You can either forward materials to those individuals when you receive them, or you could reach out to the SRAE PASS team to have those individuals added to our lists so that they can directly receive the announcements and materials. And now I'll turn things back to Jerry, who'll talk a little more about the resources to support grantees.
Thank you, Laura. Next slide, please. There are several upcoming technical assistance events that you probably have already received invites, but we want to point them out to you, particularly the first one, self-directed webinar viewings. And this was put out on October the 3rd, and you are required to view these prior to October 27, which is coming up rather quickly. And these two recorded webinars are SRAE guidance for obtaining partnership buy-in and approval for performance measures. And then the second one is online survey data collection for SRAE performance measures data. You need to view those, if you haven't, as soon as you can, like tomorrow. And then on Thursday, we will have an office hours, which is the next line. And these office hours will be talking about SRAE guidance for obtaining partnership buy-in, both of those webinars. And so it's very important that you watch those and listen to those ahead of time. And then there's an opportunity for you to send in your questions. You should have received a little form that you can put your questions together and submit those. The office hours will be most productive for you once you watch the webinars and then create your own questions. And then the staff will be, the contract staff will be answering questions on the office hours. And then the third one is webinar on December 7, 2022. And this is a webinar on SRAE implementation measures and winter 2023 reporting requirements. This webinar will just be a couple of weeks before you're required to begin submitting your measures, your data. Next slide, please. Additional resources. I want to make you aware that there is a website for the SRAE performance measures contract, and it's at www.sraepas.com. This website has tremendous resources for you, and so as you're getting started, you would be well served to go to that website and just peruse some of the resources available in addition to the 2 webinars that you're required to view prior to Thursday. And for further support, contact Public Strategies at www.sraepas.com, contact, or you can call that toll-free number, and you may want to make a note of that. Thank you.
Thank you, Jerry and Laura. And you guys also have some questions in the chat when you get a chance. So now we'll hand things over to Susan Zeef, who will discuss the SRAE national evaluation.
Thank you, Sheree. Just a volume check. You can hear me fine? Thanks so much. Okay, please advance to the next slide. Right, the SRAE national evaluation began in 2018, shortly after the legislation was signed into law. It includes 3 main efforts that are very integrated with each other. And I'm going to talk about each of them in detail, but I'll just mention them briefly here. There's the National Descriptive Study, the Program Components Impact Study, and Data and Evaluation Support. And all 3 of these are operating at full throttle right now, and we'll hear a lot about that. The evaluation has 3 primary objectives that ACF established at the time when it put together all the components of this evaluation. The first is to produce action-oriented evidence for all of you to integrate into your programs. It also involves a lot of engagement with all of you and experts and stakeholders in the field. I'll be saying a little bit about that. And of course, to uphold ACF's evaluation priorities, which include rigorous evaluation that is relevant to the field, full transparency in what we do, independence and objectivity in how we do it, and proceeding with ethical evaluation standards. Next slide. All right, so the first component of this evaluation I'm going to speak about is the National Descriptive Study. You can advance one more. There's a lot that goes on with this study. Through the National Descriptive Study, we are telling the story of SRAE programming from the. It began in 2020 with what we call the early implementation study, because it was within the first 2 years of that first cohort of grantees delivering programs. We conducted a survey of all grantees at that time, which allowed us to describe program design plans, and that resulted in briefs and a fact sheet on what the program is doing that is now published on the OPRE website. You can simply go on the OPR website and search for SRAE National Evaluation, and you will find it. So if you are a repeat grantee and had a grant at that time, you participated in that data collection effort, even if you don't remember it now. We are now planning for the second large launch of the National Descriptive Study, and that is called the Nationwide Study. Here, we're asking grantees to help us understand about the experiences in delivering SRAE programs and the lessons learned along the way. We will also look for any relationships that may exist between features of program implementation and youth and program outcomes. Those outcomes will come from the performance measures that Jerry and Laura just discussed. So this data collection will be starting this year, and as soon as we receive approval from the Office of Management and Budget, or OMB. Surveys will be of grantees, but unlike the early implementation study, we are really trying to get that on the ground perspective. So we will also survey subrecipient providers, that's mostly applicable to the states, and all program facilitators. There may also be a small number of youth focus groups associated with this effort. Next slide, please. One of the things that wasn't initially planned with the National Descriptive Study, and remember, this contract was designed and awarded in 2018, was the effect that COVID would have on programming. So with ACF, we took opportunities to learn about that. First, in fall 2020, so just months into the pandemic, and when we all kind of figured out what the implications would be for that first school year, we conducted a brief survey of all grantees to just get a pulse on what they thought they'd be able to do in that year. Then a year later, fall of 2021, we conducted a series of virtual interviews, and if you were a grantee at that time, you likely participated, to really learn on a richer and more qualitative level how changes you had to make, what the changes were you had to make as a result of the pandemic, and how they affected your program, and what you would be doing forward to ensure successful program implementation. There will be a fact sheet on those findings that will be released shortly. Next slide. All right, now I'm going to talk about the program components impact study, which is something that's pretty unique to this evaluation. And so you probably haven't heard about a lot of research that's conducted the way we are conducting this, this effort. Next slide, please. So first I want to take a step back. And for all of you who are familiar with effectiveness research such as, is a grant program effective, or is a curriculum effective? A lot of what we get is a thumbs up or a thumbs down at the end, or maybe a no thumb at all, no difference. But what we are studying is everything that went into making that program. What we do with program components research is unpack that black box. The next slide, please. So what are program components? Well, per ACF's definition, they are essential. They are irreducible, meaning it's down to the smallest part of these prevention programs that are considered critical for achieving the program goals for youth. So what could these be? It could be, they are a combination of everything that goes into what you bring to youth, including your selected curriculum, the supplemental activities that may accompany it, who your facilitators are, and their facilitation strategies. These are just illustrative. I'm sure each and every one of you, if you thought about everything that goes into your programming, could probably come up with a much longer list. So how does studying program components differ from a more traditional effectiveness evaluation? Well, mostly it's the question. So in that traditional evaluation, you're asking, like I suggested earlier with the black box, is the program effective? But in program components research, we're looking deeper and at specific components. So one question one might ask is, why is the program effective? So it would be, what is driving success? The question we are actually asking for this study is, how can components of programs be improved? Next slide, please. Okay, so our goals were to first identify and then improve components that are critical for program success. So how did we identify the component we were working with? We're starting from scratch. It's like we were opening a restaurant and we had to decide what to put on the menu. We had to start somewhere, and we couldn't do every component of every program at once. So we met with stakeholders and program experts throughout the first year of the evaluation to identify the components that they thought were of the greatest interest and are the critical components for program success. And now we're at the second phase, which is to improve, studying the implementation and outcomes of the components we selected. Next slide, please. All right. We are testing the use of specific strategies designed to improve facilitation. And why? Because when we met with experts and stakeholders for a year, they expressed that this is a strong priority for the field. It was consistently identified as an understudied component, but the one that is most critical for getting the SRAE message to you. We also found that the evidence base really does not address facilitation within the context of an SRAE program. So our focus here really addresses a key knowledge gap. It's also a core component across all programs. There is a process by which the content and the skills are communicated to youth, most often through health educators or facilitators. Therefore, studying facilitation really yields the greatest benefit to all SRAE programs. We identified 2 facilitation strategies that were kind of in an infancy of development, and we piloted them in the spring 2022. Now, one strategy has moved to a larger scale replication study with an impact and implementation component. And the implementation of the second strategy is going to be refined through some additional research. Next slide, please. I'm going to quickly say a little something about what strategies are so you can get excited about what's forthcoming. So the first one is using co-regulation strategies as part of your facilitation. Youth need skills in self-regulation to promote positive relationships and avoid risky behaviors. And the SRAE, knowing that, the SRAE legislation requires grantees to address self-regulation in their programs as part of A2F. Facilitators can help youth support their development of self-regulation skills through co-regulation strategies. This involves, in kind of big buckets, creating warm relationships and supportive environments and coaching youth on the skills they need to build their self-regulation. So we took, I said projects were kind of in their infancy when we identified them. An ACF project, not this one, another one, developed a toolkit with 6 co-regulation strategies that were co-developed with programs that serve youth. The 6 are on the slide there. For our study, we are focusing on the first 3, welcoming, positive practice, and breadth of focus. And as we can, we will integrate some of the remaining. Next slide, please. The second strategy we call Facilitator Foundation. And that's predicated on knowledge that behavioral change in youth is not possible unless you understand factors that predict behavioral change. And then facilitators can play a role in kind of supporting you in making progress on these predictors, or some people may call them mediating factors. Again, we went to prior research, which has identified attitudes and beliefs that will predict the avoidance of sexual risk. And the 6 core ones are here on the slides. There's probably no surprise here for all of you who've been working in this field for a while. We are now taking the predictor justification for sex and refining it into some learning modules that facilitators can use to better understand the predictor and how to operationalize it in the classroom. And justification for sex means the justifications that youth will use when they're thinking about initiating early sexual activity, and then what is the facilitator's role in helping you to kind of see all the whole picture, including the risks, the consequences, and giving them the self-efficacy with that knowledge to make a healthier choice. These predictors were actually first introduced to SRAE grantees a couple of years ago, and that webinar lives on the exchange, which I'm sure Katie will talk about. All right, next slide, please. And finally, I'll wrap up quickly with data and evaluation support. Next slide. It includes 2 components. The first is local evaluation support. So we're here to support you in conducting high quality evaluations, whether they're descriptive, qualitative, or more quantitative impact evaluations. So if you're conducting an evaluation, we're here for you. And for those of you who might have posed an impact evaluation in your grant application, we'll be contacting you shortly. So topics that we will cover are design, measurement, development, and testing, best strategies for data collection, analysis, and reporting. We provided individualized support, but we also have many resources on our website that you can also access to improve the quality of your local evaluation. Next slide. We also help to improve your ability to use data to make the decisions about your program. So how to use data and research to improve your programming and outcomes for you. This is available to all grantees. Most of this involves cross-grantee efforts such as webinars and training sessions and available toolkits and videos. We've covered topics including logic models, continuous quality improvement plans and the implementation of those plans, implementation evaluation, how to measure and cost out your program, and best practices for data collection and storage. Okay, next slide. Our website offers a wealth of resources, and it's updated frequently and will particularly be so in the coming year. So it's sraene.com. Please do visit it and see if there are resources that are germane to your plans or what your individual needs are. Next slide. And then how can you engage with us in the next year? It is the next year for us. The evaluation contract will end next September. So we really hope we can hear and engage from a lot of you during that time, from all of you. So first of all, you can respond to opportunities to participate in SRAE activities. Those will most often come out through email blasts. Like I said, please review the SRAE website for resources and keep going back to it as resources are added. One of those resources includes the SRAE newsletter, so that'll keep you updated on what we're doing and what you can expect from us. Go ahead and review those briefs from the early implementation study that I mentioned. Like I said, they are on the OPRE website. Just search for SRAE National Evaluation and then contact us for any reason whatsoever. Any question related to evaluation that you have, we will make sure it gets to the right person. And next, and I think the final slide. Here's how to get in touch with us. So this is our project specific email address. Please write it down, and our website address. Also, all you really need to know is our website address, because from our website address, you can also link to contact. We look forward to working with you. Thanks so much.
Thank you, Susan. So before we hand things over to our wonderful TA provider, RCI International, I just wanted to survey the audience really quickly. And I know Title V CSRAE is very long and tongue twisting. Are there any grantees that have like created a little nickname? You have like, you call it something else in the office, so it's not too much. Is there any nicknames or anything anyone wants to share with the group or can share with the group? You could come off mute, you could put it in the chat. I kind of didn't want to use the chat because things, get lost. Okay, we got Project Hearts. Okay. Any other nicknames or something you call Title V CSRAE because it's so long? Project 209, OSA-RAP. Ooh, that is interesting. I would like to hear more about that, but I know we don't have a lot of time. Built to Last. Okay. Good names, because I have been getting tongue twisted this whole presentation. Family Bridges, Bridge Keepers, Focus Forward, Resilient Youth Nation. Okay, I like that one. That's a good one. Better Futures, Brighter Futures. Yes, our young people need to know that. All right, well, keep the chat coming with your nicknames for Title V Competitive SRAE. I'm gonna hand things over to Dr. Kanika Hall and Kaylee Solentrop to discuss TA.
Thank you, Cherie. So RTI congratulates you again on your award, and we look forward to working with you as your training and technical assistance providers. Next slide, please. And next slide. So RTI has been contracted to provide no-cost training and technical assistance to grantees. We do so with the support of our subcontractors, Child Trends and Needs. Next slide. So what is TA? So TA can range from helping you define a problem, addressing an already identified problem, developing new solutions, being proactive and taking your program to the next level, building on the strength of your current program, anything that you might possibly need. I know a lot of times people think of TA as something that's punitive, but it's not. We're here for you if there are some things that you would like to improve. We're here if there are some problems you need to troubleshoot and solve. We hope that as you work with us as your TA providers, you build a relationship with us. And as we work with you and learn more about your program, that we're able to apply a collaborative approach that customizes results for you that are driven and helps your program succeed. Next slide. So we offer TA in a couple of different ways. This can range from one-on-one sessions with your agency and a TA provider, or in small group settings. So we hold office hours and cluster calls that are typically topic focused. And so we dive in with experts to give you ideas and suggestions. And we also welcome input or ideas, suggestions, or best practices from individuals who are on the call. We also have liaison groups, which are also a small group setting that can be topic-based, that is open to individuals based on a set group or commonality, so that you're able to get peer input and peer ideas and peer suggestions and share your best practices with other grantees. We also offer webinars that are there to strengthen and sharpen your knowledge around topics. As Cherie mentioned earlier, programs are reviewed during PO-led site monitoring visits to determine your program's strength areas and where TA may be helpful. So currently site monitoring visits are virtual, but they may be in person as travel limitations allow. We also host the exchange, which includes tip sheets, infographics, recorded webinars and prior training and conference materials, which may be accessed at any time. RTI also hosts topical trainings twice a year and the annual APP Grantee Conference. Both provide additional opportunities to learn and sharpen skills as well as network. Next slide. So how do you find out about TA opportunities? So office hours, cluster calls, webinars, and other events are shared via email e-blast. And to make sure that you don't miss them, because we know everybody's inboxes can get full rather quickly and things get pushed further down in your list, our liaison group leaders will resend out information to individuals in their group, since you're used to seeing their names, hopefully, and that will draw your eye or your attention to it. Events are also posted on the Exchange events page. And if individual TA is needed, you can reach out to your TA liaison as well as to your project officer. Next slide. So let's talk about that individual TA reach out to your project officer. So you would contact your project officer, or when you have your monthly or bi-monthly meetings, there may be an area that keeps reoccurring in your conversations or some identified need. And so your PO will request TA from RTI. RTI will assign you a TA provider whose skills best matches your need. The TA provider will reach out to you and schedule a time to meet, and then you'll begin working together collaboratively to address whatever your need may be. Together with the TA provider, you will develop a plan, and we will keep your project officer informed on your progress. The TA provider may check in regularly to support you until you feel like your need that was identified has been met. When you reach that goal or you feel like your need has been met, the TA request will be closed. And at the end of that closing, you will be sent a satisfaction survey to let us know how things went with your TA provider. We do ask that you please fill that out so that we can make sure that we are providing you the support that you need. Next slide. So a couple of upcoming events that you may have already received in your email, but if not, I want to draw your attention to them so that you can either search for them in your email or put them on your calendar. So we have a webinar on providing services to youth in foster care and juvenile justice systems coming up on the 27th, and a cluster call regarding engaging and speaking the language of education partners. So again, please check your email or go to the Exchange website or reach out to us in the chat, and we can make sure that you have information about these events. Next slide. There are 2 topical trainings that we hold annually. The first will be November 15th through 16th, and it will be virtual. Please note that 2 key staff must attend at least 1 training, so please plan accordingly. Topical training topics give you the opportunity to learn information, gain a new skill, and also network. We are hoping that the topical training in March will be in person, and the topic for that training will be announced. The one for the first one is promoting the avoidance of risky behaviors using trauma-informed self-regulation strategies. Next slide, please. We are very excited that the APP annual conference will be in person this year. We will be holding this on May 23rd through 25th in 2023 in Atlanta, Georgia. And so we are very excited about being able to have this face-to-face time with the grantees and the project officers to network, finally get to meet everyone, and just share a lot of the information and successes that are in your programs. Communication for the conference will begin in November, so please keep a lookout on your email for that. So we will be sending out ways that you can participate and be engaged during the conference. And so we ask that you please consider thinking about the successes of your programs and lesson learned, and submit an abstract so that everyone can see and learn from the great things that you're doing. If you have a great success story, or you're doing something that's innovative, submit a success story so that we can highlight you during the conference. And we're all here to serve youth. So if you have a young person who you would like to nominate for our youth plenary session, please do. So please keep a lookout on your email on ways to participate and engage in the conference. Next slide. So to sum things up, we are your training and technical assistance provider. And the provider is a loose term. I would like to use the word partner. So we are here to make sure that you have everything that you need to successfully implement your program. We do that through toolkits, resource guides, e-learning modules, site monitoring visits, just to keep a pulse on how things are going and be able to provide proactive solutions or proactive assistance as needed. You can look on the Exchange for topical trainings, webinars, infographics, and tip sheets that have already occurred, and look at the calendar for ways that you can engage going forward. We are excited about the Grantee conference and look forward to meeting you all. I'm going to turn it over now to my colleague, Katie, who's going to talk a little bit more about the Exchange. She's going to talk about the e-newsletter that we send out, some of our health observances like National Pregnancy Prevention Month, and about our We Think Twice campaign and website. I'll pass it to you, Katie.
Awesome. Thanks, Kanika. And Shane, you can go to the next slide. And the next one. So the primary way, well, I guess sort of what Kanika summed up is how do you access us, or how do you access, this is specifically for individual TA. You can reach out to your project officer and let them know that you'd like to have an individual TA on a particular topic. And you also might have already received information about some of our proactive TA opportunities. So we offer liaison groups to all of the SRAE grantees, and you are grouped by funding stream and general region. So if you haven't already received that, more information about that is forthcoming soon. And then the main way that we provide information and communicate with you all, is through the Exchange or through eBlast. So I'm going to pop the Exchange link into the chat here, and you can visit the Exchange. It really is designed to be your one-stop shop where you can find information, like you can find webinars, cluster call summaries, tip sheets, toolkits, e-learning modules, and we'll walk through a few of the other resources available on the Exchange. We also do send out a fair number of e-blasts or emails to provide you information about upcoming TA events or upcoming TA resources or resources that are shared. So we would encourage you to make sure that you have the following domains in your safe senders list. So that would be sraetta@rti.org. And also there's a separate quarter or newsletter that comes out through some of our other colleagues through another partner organization, and that comes out on a quarterly or biannual basis. And that information is on this slide. I would encourage you to sign up for that or make them a safe sender if you're interested in receiving that. And if you can go to the next slide, Shane, I'll just walk you through a little bit about what you can expect from the Exchange. So again, here's the link to the website itself. There are you can access the Exchange just publicly. All of our resources, or the vast majority of our resources, are available publicly. You can also log in. And to have the login information, you need to have your grantee contact sign up, and then they can designate who else is affiliated with your grant to get your team logged in for the Exchange. If you go to the next slide, please. You can find resources. We have a resource library that you're able to search on. Again, I mentioned tip sheets. We have all of our webinar recordings and the slides. We have different toolkits. You can go to the next slide. And then we also have this events calendar. So the events calendar will tell you when we have trainings, cluster calls, webinars, and different events for you to participate in. There's also information about health observances. So for example, I believe October is Suicide Prevention Month. There you could click on the event post for that and it would provide you with more information about how you could learn about Suicide Prevention Month or share information on social media. If you go to the next slide, we also have a grantee network comment wall. So it allows you to connect with other grantees and share resources and share ideas that you have. And that's behind the password. So you'll need to log in to access the grantee network. One more slide. And oh, I guess you can go back, Shane. The other thing that we have on the exchange that you might be interested in is the studio tool, where you can go and look at some of our tip sheets that we have available, and you can customize them to put your own logo. So if you find that helpful for sharing with stakeholders or other partners about some of the topics that we've selected that are of greatest interest to the grantees, you can kind of brand them for your own project, so you don't have to reinvent the wheel or recreate resources that we've already created for you. And if you have any challenges accessing the exchange, or you need additional support on how to find things, we're happy to help you. You can just email us at sraetta@rti.org, and we can make sure that you have the access that you need to take advantage of all the resources on the exchange. All right, and now we're going to talk a little bit about some tools that we have available for young people directly that you might want to incorporate into your programming. You can go to the next slide, Shane. So we just wanted to take a few minutes to talk about the We Think Twice campaign. And the We Think Twice campaign is a digital and social media campaign that's designed with youth and for youth, with the goals of helping teens to build knowledge and skills, to form healthy relationships, set goals for their future, and feel empowered to make healthy decisions. It really supports the goals of APP grantees, including SRAE grantees. There's somebody in the chat talking about the materials. I'd encourage you to look at the website. There's listicles, interactive toolkits, different quizzes. So it's a way that if you are looking for some more interactive materials, say like for an icebreaker or something for your young people to do either in the classroom or maybe as an extension of your work, it's something they could do on their own mobile device or another device that supports the same goals, and it fits within the guidelines that Cherie was talking about earlier, that meets the needs of the SRAE grantees. There's also one of the goals of the campaign is to shift perceptions and social norms to help support young people resist negative peer pressure and really applaud their efforts to set and achieve goals and help them realize kind of what is possible for them in their future. And some of the tools that we have are like mentoring tools that you can explore, thinking about careers, that sort of thing. You can go to the next. We'll dive into a little bit more about what we have available. You can go to the next slide, Shane. So the hub of the campaign is really the We Think Twice website, which is a website specifically for young people. We also have products for that you might want to use in your group rooms or in classrooms that are on the exchange. You can find information on the exchange about We Think Twice or from We Think Twice as well. We also have an Instagram account, and we do have a Facebook page as well. So if you are on social media, we would invite you to follow us and share our materials. And then the We Think Twice Insiders are a group of over 200 young people it's digital, and they provide insight and input on kind of upcoming products that we're developing. They help create some of the content for the Instagram and Facebook pages, and they really help guide us on providing us real-time feedback on kind of what young people are thinking and what they are interested in with respect to the parameters of the campaign itself. And we're really excited to be able to tap the knowledge of the insiders on a weekly basis. If you go to the next slide. It's kind of how all this is just what the website looks like. And we're trying to keep it as simple as we can, although as we kind of continue to add things, now we have an inspiration gallery where you can see materials that young people have submitted to different contests that we've hosted. So we just closed out our summer of contests, and we had 3 different contests throughout the summer in which youth they gave us a picture of success where they drew a picture, they kind of submitted a meme about how things were going for their summer. And then we had them, the last contest was a photography contest where they took a picture of what they were most proud of that they accomplished over the summer. So for some people, it was getting outside and, completing a really a challenging hike or something like that. For other people, it was, reading a certain number of books. For other people, it was doing internships, and some people it was like connecting with their family, and they took different pictures and submitted them. And you can see submissions on our inspiration gallery at the website as well. If you go to the next slide. Again, we have so much content on the website, and we're adding to it all the time. We cover topics of healthy relationships, goal setting and success, making smart choices, and we've added a lot around mental health, including coping with COVID-19. So I would encourage you, we have some great videos of young people talking about the challenges that they've overcome, and kind of the tools that they put in place to try to overcome those challenges and achieve the goals that they have. We also have some inspirational music. We just wrapped up another contest on that last week. So we'll have a new playlist that we'll be putting out, just that you could use in the classroom or use with your young people if that's helpful. Go to the next slide, please. We just wanted to share a little bit about some of the metrics. So we launched our Instagram and Facebook accounts in July of 2019. And since then, or since this fall, we've had more than 48 million social media impressions, and we have about 4,700 followers on Instagram. I think what we're most excited about is that our average organic engagement rate has been right around 9%, which is kind of triple the industry average. And we're just really excited that we're able to grow the number of people that are seeing the content while still having a lot of interactivity on that content. As I mentioned, we've had 260 people that have registered to participate in our We Think Twice Insiders community, and we've had more than 2 million views of our videos or different stories that we've put out. You can go to the next slide. And then our website was launched about 9 months later, and since then we've had 163,000 users on the website. They look at the website for about 30 seconds, which we think is great because we know that attention spans are pretty short. And they visit about 1.3 pages, and a lot come to our website to look at the videos that we have, to participate in the quizzes and participate in the games. And we get a lot of visits through our social media as well. Go to the next slide. And this is just some examples of the engagement activity. I mentioned that our engagement metric is one that we're really proud of and excited about. And we have found that having kind of either giveaways or contests where we're really engaging young people in the content themselves has been really a powerful way to keep the engagement going. So one of my favorite activities that we did was a motivational quote where we had young people submit their like quotes that lift them up or the quotes that motivate them. And then we turned it into a Monday motivation series. So every Monday for over a year, we had another quote that a young person submitted. And those consistently were very high engagement quotes. The young people really liked those quotes. They saved them a lot. And it was all content that they themselves told us was important to them. So it was just a really nice way of inviting young people to help drive the campaign in a way that is really positive. And then we also did, a couple of years ago, we did an arts contest on setting goals for 2021. And we got over 250 submissions to the contest. and we had young people judging the artwork itself, and we had to like get more judges because we were just the engagement level was so much higher than we anticipated. So that was really exciting. The arts contest continued to be really youth continue to be very excited about that. You can go to the next slide, please. And then we've won a number of awards for our We Think Twice, some of our tools and some of the resources that we've put out. So we're proud of that. And we're really grateful for the Family and Youth Services Bureau partnership on this project. It really has been a partnership between us and FYSB and the young people and our insiders. You can go to the next slide. And so I think one of the reasons why we wanted to tell you all about We Think Twice was we want you to get engaged in the campaign and use the tools and resources, but we'd also really encourage you, if you have young people that might be interested in this sort of thing, we'd welcome that to them to participate or sign up to be part of the insiders. You can register, you can put in an application on the We Think Twice website. And then as we go forward into the next year, if we're interested, if we have the opportunity, we love to also do group level design sessions and that sort of thing as we come up with new products. So feel free to email us if you're ever interested in that. Go to the next slide. And you're welcome to, again, email us at any time. You can, if you have questions about the training and technical assistance, and separately, we can also answer questions about We Think Twice. I think that might be it. We're going to go ahead and transition into questions. So if you want to put your questions in the chat, that would be great. You're also welcome to come off mute. I think the easiest way, given the number of people, is to raise your hand and then you'll pop up at the top. The first question, and I think this is how often are materials submitted to the medical advisory board? Who would like to answer that one? Cherie, do you or someone from your team want to answer that?
Hi, Katie, it's Labrita. I think Takia can respond.
Awesome. Takia, are you still there?
Sorry about that. I was trying to come off of mute. Can you all hear me okay?
Yeah.
All right. And so we will, after the training on the 31st, we will have an initial opportunity for grantees to submit any curriculum that needs to be reviewed. And then it's kind of a rolling cycle after that. Like as grantees, if you want to implement new curriculum or change curriculum, when you're meeting with your project officers, then we'll be able to kind of collect that information throughout the grant cycle.
Mickey, does that answer your question?
Yes and no. Thank you so much. I really appreciate it. So if we were reviewed, like we were funded in 2020 and had a 2-year run. So I just wondered, because we were refunded in 22, and we updated all of our materials and they got approved. And unfortunately, some of the data is not updated like through the CDC often enough to like warrant a whole new reproduction or new, you know, if we go through and if we get like 1 or 2 pieces of data that are updated, but then we have to rerun all of our materials in terms of printing. So that's what I wondered, if we were approved, got through the medical accuracy review in 2020, would we have to be approved again in 22? Maybe that's more clear. Thank you.
So are you saying that the curriculum was updated?
Yes, after our medical accuracy review in 2020, we got our feedback, we updated it, we reprinted, did all that stuff. So I just wondered if we would be going through that again in 22.
If there are changes to the curriculum, it does need to be reviewed.
Oh, we submitted our changes as in 2020. Once it was reviewed, we submitted any changes we made, we got the green light, so then we reprinted.
Okay, and you have not made changes since then?
No, we have not.
Oh, no, then you should you should still be on the curriculum that you're using should still be on the list of approved curriculum.
Awesome.
Your federal project officer should have which curriculum you're using. And I've actually already started checking to make sure that they're on the list.
That's
Does
very
that-
helpful. Yes, yes.
Okay.
Excellent. Thank you so much.
No problem.
So, Tekia, just this, so if you were previously approved as a CSRAE grantee to use a curriculum, can they move forward using those previously approved curriculum for now?
Yes, if you have curriculum that's previously approved, you can use that. And I see Labrita off on camera, so she's probably going to help clear this up as well.
Yes, thank you, Takia, and thank you all for those questions. So it actually is dependent upon the time frame of the last approval as well. As Takia said, within the last 2 years, but if it's outside of that period, please check in with your federal project officer, and your federal project officer can follow on with Takia and will provide you more information. Also, there's an information session that's coming soon. I think Takia announced, and we'll share more specifics about the medical accuracy review, including timelines and timeframes.
What other questions do folks have?
Katie, there's a question in the chat I don't think was answered. Is an IRB required if we are funded for a second time?
So I think that in response to that question about IRB, it's dependent upon, I would assume, the time frame for your approval. So please check in with your IRB. And I'll also invite Laura or others who are on the call who support grantees around data collection to also chime in.
That's exactly what I would have said. It depends on your IRB. If when you originally submitted your IRB information to them, you stated that it was a 2-year project, a 3-year, however long you stated it was, if we're now beyond that point, you should at the least let them know. IRBs often have a process for doing an update so that it's not the full submission process again, but do just reach out to your IRB and ask them what would be appropriate.
And I can take this one, Katie. For site visits, is that to our home office or to our implementation sites? So for the site visits, we are looking to make those in person next year. So those would take place in the office as well as the implementation sites, because we would be observing implementation. Some grantees implement at their site. So if that doesn't apply to you, of course, but yes, it would be both at the home office and at your implementation site. And Takia, there's a question, no problem. There's a question about getting the information for the October 31st meeting. I think you said that that's gonna come from the project officer.
It should have already come. You should have received it from, sorry, I keep forgetting to do mute and video. You should have received it already from either Roxanne Thompson or Gray Matters. If you did not receive it, please let your project officer know. So then we can make sure that we add whoever we need to add to the distribution list.
Also, I would just add, please check your junk or spam mail. Sometimes that can be a challenge, but we'll work to have project officers resend that information to everyone so that you will have it directly from us as well.
So is that all the questions we have? I mean, we have another 30 minutes, guys, so I guess everyone's ready to go. If there's no more questions, go on once, go on twice. All right. Well, I want to thank you all for attending our orientation. I appreciate everyone's time and flexibility on being here. Big shout out to our presenters for getting things done and presenting as well, so I didn't have to talk the whole entire time. And I want everyone to have a great evening, and you get 30 minutes of your day back, or afternoon. Some people are on California time. So everyone have a nice day, and we will talk to you all soon in another webinar.